Good day, everyone. Welcome back to the Dr. Detox Show. I'm Dr. Darrell Wolfe, and today's show is Couples, Treatment, and Training. So let's begin the show.
Hey, everybody. Thanks for joining us. With me is Carmen and Ben, and you know what? Talk about bravery. I mean, you know, there's bravery coming on and just talking, but the reality is what I tell everybody when they come here, and this is the truth. People always say to me, can you give us real live people who are going through your protocol? So we didn't talk about anything, did we?
Nope.
I just asked you if you wanted to, right? And one of you did and one of you didn't. No, that's not true. Okay, so anyways, so you guys decided to check it out. Why did you come here to the Doc of Detox?
Well, I came to bring my wife here. That was my purpose, because
that's a great husband, though, that you did that.
I thought I didn't have any issues
In your tissues.
in my tissues. Correct.
That's right. But meanwhile, look at this. He believed he didn't have any issues. Meanwhile, how many heart stents do you have?
You have to ask my wife. 2 or 3, I'm not sure.
You got 3.
3.
So he has 3 heart stents, but he doesn't have any issues. And what else? There was something else going on with your prostate, right?
Correct.
And you also have an inguinal hernia, right?
Yes.
So, but there's nothing going on with you. So I just want to say something. Isn't it amazing today? You can actually have an autoimmune disease, okay? You can have 3 stents, an inguinal hernia, and a prostate problem. And let me tell you something. This is exactly normal how you feel. Because guess what? Today, we call health not being in the hospital. If
That's
we were
right.
to go back 100 years and tell somebody that, you know what, I'm healthy. You know what, I'll actually be talking to a person that has had 3 or 4 surgeries. They're on 6 different prescriptions. I'm not making this up. And they've got about 30 to 50 pounds extra on them. And I'll say, so how do you feel about your health? I think I'm in great health. So when you compare yourself to the majority of the population, we might have a problem. So from now on, we can never compare ourselves to our family, our friends, or anyone else. We have to say to ourselves that we are unlimited on how healthy we feel and how young we can feel. So anyways, why did you bring your wife here?
Well, she's got back issues and sciatica and
That's good. That's good. Because we haven't got all day. Now, okay, I'm kidding. Okay. Should we do it alphabetically or minor to major?
she's the one with the issues.
That's the truth. I did have really bad back issues, and that's at least over a year. That started in 2018 in December, and it was just a groin pain, and I thought, oh, why is my groin sore? So you start limping because the groin is sore. And then next thing I know, come June, I can hardly walk. Okay, my back is sore, my everything. So I decided, okay, I got to do something. Don't know what to do. Not going under the knife. Not.
Yeah, but your family
Oh yeah.
and friends, what do they say?
My family and friends were supportive at first, but they said, Carmen, you got to do something. You got to go and see a neurosurgeon. You got to go see your doctor. He's going to give you an MRI, and then you're going to be, then you'll know what it is. Okay? And then I thought, no, I'm not doing that. Because next thing I know, I'm under the knife. And no, there's got to be a better way. There's got to be a natural way to look after this. Here I am. You know what? I tried all kinds of natural things. I've been going to the chiropractor for years with this lower back issue. Years. Okay. And that, it has helped. I won't say
because
it hasn't helped.
what the chiropractor does, because what's happened is that beautiful connective tissue that's elastic, flexible, okay, and has lots of blood supply. It shrinks because it dehydrates. And then it can keep shrinking, and then it gets calcified. So he may align your spine, but it won't stay there.
And it never did. And so I would keep going back, right?
Yeah.
Once a week, sometimes twice a month, whatever, okay? And it would work. And immediately I felt relief and I was okay, but then it would come back. Finally, when I went to see her, she says, we should do an x-ray. And I said, what for? What's that going to change, right? And I agreed, did the x-ray, and then that showed all kinds of, and now stenosis of the lumbar and this and that and curvature of the spine, and I have it all, okay? And you know what? When you know that, you're like, holy moly, like I'm really bad shape. So people are telling you, did you get an MRI? No, I didn't get an. Are you going to? No, I'm not going. And I'm looking for a better way till finally somebody who knew somebody, my sister who knew somebody that knew you, said, the doc of Detox. And I thought, oh, brother, here we go again. Because I had tried the chiro. I tried acupuncture. I did dry needling.
I have a doctorate in acupuncture.
Okay, see, I didn't
And
know that.
how often have I used that on you?
You haven't.
That's right.
Thank goodness, because it didn't work.
I know, but
Right?
it helps to move energy and balance energy. But the problem is it's a calcium scar tissue crystallization issue.
Nothing worked.
Yeah.
And so here I am thinking, you're my last hope. Because after this, I thought, if this doesn't work, where am I going to go? Who's going to help me? Do I have to go to a neurosurgeon? I didn't know. I thought, I'm done after this. My last hope.
Right. So just know this, everybody, that I'm going to play an audio for you tomorrow. And that audio is going to be of a neurosurgeon, one of the top surgeons, back surgeons in New York, talking to one of my patients who had stenosis. And just so you know, just to make it really clear, oh my God, you've got stenosis. The nerve is dead. We're going to have to go in and operate. Okay, I'm going to tell you something right now. God loved them all, but guess what? They don't know that they are precipitating a lie. Because what happens is the scar tissue and the calcium has wrapped itself around the nerve to protect the nerve. So the nerve is not dead. So even though you may feel pain going down your leg, well, that's actually, the nerve gets shortened as well. But the problem is not the nerve in the spine. The problem is actually the sacroiliac joint. We call them the lower body eyes. They get all the scar tissue wrapped around here, and that causes the pain with the sciatic. Okay? So with the stenosis, they tell you the nerve is dead, and guess what? I will tell you right now, I'll give anybody a money-back guarantee because they can't see the nerve, so of course if it's not there, it's dead. Now the reality is as soon as we go in and we do Wolfe non-surgical on your spine, you can now see the nerve because we get the displaced calcium off of the tissue that's wrapped in the scar tissue around the nerve, and now you can see it. So that's just like if somebody with a knee or a hip problem, like your hip, they'll tell you there's no cartilage, no tissue in there. It's bone on bone. Actually, the tissue has become thinned out like beef jerky because it's no longer got the blood supply, lymph supply, the energy supply in it, so it gets thinned out. It can come down to 1/8 the size and become calcified, and they think it's part of the bone.
Yeah.
And as soon as we go in there and start bringing the energy back, the tissue comes back. So surgeons believe that the body cannot heal. Doctors believe you need drugs. Now, I'm not putting them down because drugs have their place. Surgery has its place.
Yes.
But when surgery and drugs becomes part of your daily routine and you actually get people believing the body will not regenerate bone and tissue, then we've got a problem. We've got an issue in what we're teaching people. So anyways, you came for the consult. You weren't coming for anything else, were you?
Well, no, because we're from out of town. So I thought, well, we'll just go get the consult, see what he says, and take it from there, right? But when we got here, it was like, okay, we're here. We may as well do the
Non-surgical.
The non-surgical as well. And you know what? I want to say today, I have more pain because of the the non-surgical than I have on my back, and that's what with 2 treatments, right?
Yeah. So explain what that means, though. So are you saying that we made you worse or we made you better?
Oh no, you made me better because I know that the deep tissue, like it's tender. It's
that's what you meant. It's
that's
tender.
what I mean. It's not pain. Like, oh my gosh, now what? Oh no, it's very tender though. I'm sitting on my behind right now, and I'm like, okay, it's a little, but my back is.
But
good
it feels
right now.
alive.
Oh, yes, it does.
and you've got your flexibility, and you've got you can know that you can bend now without feeling you're going to tear out.
Yeah, and I can stand for longer periods of time. I mean,
2 treatments, right?
that's right, 2 treatments.
And you thought you were going to have to go to surgery. So what do you
well,
think now?
I thought that I was going to be having to walk with a cane, and I'm thinking, oh, heck no, this is working for me for sure. Like, I'm thrilled because I was so scared that the next thing was surgery and the cane or the walker or,
Well, that's what it is. It's cane,
build the
walker,
ramp so I can.
wheelchair, depends. And then
Exactly.
guess what? He was already discussing when you went to the washroom the other day when you first came here and we were outside. He was saying, look, I don't want to have to put her in a nursing home, Darrell, but I think I'm going to have to. No, that's not true.
I was going to say, did we leave? Like, when we had the consult. But you know what? Like, it's worrisome. You're thinking, okay, I'm whatever age I am. Well, okay, I'm 69, okay? And this developed over the last 2 years, but I've had problems with my back forever. And we talked about why that would be, right? And yeah, I'm thrilled. Like after 2, today I'm like, oh my goodness, like I'm really. You know what? Last night was the first night that I slept and didn't wake up with pain. Pain would wake me up.
How does it feel to know that you're not going to have to be a cripple?
Oh my gosh, I can't even explain it because I was I was desperate. I didn't know what else to do. I thought this has to work. If this doesn't work, I don't know where else I'm going to get natural help. Like I'm not. You know what? Doctors have their place. I get that. When I had my kids, I went to the doctor. But yeah, I'm not a pill girl. I'm just not. Don't give me prescriptions. Not into it.
Yeah.
And this seems to be, I mean, I'm not making it up. I can stand because weight bearing was just the worst. Sometimes I could hardly walk we live in a mobile home. There isn't, 5,000 square feet in the place. It's like small. And sometimes I could hardly walk from my chair to the bed, which was going across the dining room, the kitchen, and the bed is there. And when you have to think about it, before you get going, you have to psych yourself up because it's going to be painful to get there. No more.
Well, I make you this promise, and I'm going to say this to everyone, that we have a money-back guarantee to everybody that comes here. And I told you, we have a money-back guarantee. If after the first treatment we don't do more for you than anybody else has ever done, then don't pay. And how was the first treatment? Did we do more?
Oh, yeah. The first treatment was like, I said to him, we went back to our park there, and I said, I feel like I can stand like I could actually stand at the table and cut up the veggies, without having to, sit down and bring the thing to me and, I need a knife. Can you get me a knife? And
yeah.
done.
And if it's okay, I want to talk to you about something else here,
Sure.
about mind over matter. So when she was here and she got worked on, she wasn't limping. And then I saw her go to her car and she was limping. And I said to her, were you in pain when you left? No pain at all. I felt amazing. And I said, see, your body gets used to saying you must limp to protect that bad hip, that bad low back. And you were actually limping for no reason.
Yeah. It's kind of, you think, because it's been a year and some, right?
Yes.
Now you're thinking, when I get up, I can't just get up and walk. I have to, get up, stand, and then start walking. And you kind of anticipate that there's going to be pain there, but there isn't. And I'm like, what the heck? Okay, well then. So I got to relearn.
So now the big job is going to be that she needs to put messages throughout the car, messages in the bathroom, throughout the trailer park, above on the cupboards. Okay, you're healed. That's all you got to say is you're healed. And once you've read that message 10,000 times, because it takes that much. Because look at whether you're doing a program that's healing you or killing you, it all had to be learned. It all had to be repeated. It's like you say to people, why do they do that? Why are they doing that? Because they've done it too often. The things we do the most, we never think about.
Yeah.
they become habits, which means every cell in your body has taken on the program. I mean, do you think about putting your pants on, going to the bathroom, brushing your teeth, making coffee, giving your wife a kiss? You don't have to think about any of these things. It just comes. It's automatic. You know, ask yourself, let me see, did I kiss her today? Because it's so automatic.
Mm-hmm.
Did I do this today? Did I brush my teeth? Well, it's so automatic. You can tell, yeah, I did. But the reality is habits are learned, and they have to be broken if they're not going to create a strong foundation. So anyways, so how do you feel?
The only thing that I feel is the it's not the pain, but the, what do you call,
Your heart?
The pressure.
the pressure from having the treatment, or the
Like it's tender.
the tenderness. Yes.
Okay, well, that's bruising. That's tenderness. Understand something, everyone. I'm teaching a clapping course that's coming up in just a couple of weeks. I already did a clapping course that I'd like you to go take a look at, that you need to look at. And it's clapping your heart and lungs for health. And it's in my DIY in YouTube. And understand something. Clapping is the most accurate diagnosis in the body. You will only be as tender when we do the work as how much disintegration, calcification, crystallization, and scar tissue is in the area. So understand, I could clap here, okay, hard as I can. I can clap here with a Doc of Detox clapper or my hand. And I could do that for half an hour. And you would not see anything but red. Red is healthy. I guarantee if I got him to clap, fairly hard for 5 minutes, he would go black and blue and purple, because the inner arm is reflex to your heart, and you've got 3 heart stents. And when you came here, what is the first thing I said? You said, I came here for my wife, and I said, you better have come here for you because you've got a heart problem. And I said, you've only got a few years.
Yep.
And I didn't know anything that you had a heart problem, did I?
No, we hadn't talked about it at all,
That's right.
because I wasn't coming here for me.
Yeah, she actually called in ahead and said, pretend that I didn't call so that you can scare him. No, it's not true. She didn't do that. So anyways, I can tell, as soon as a person walks in, I can tell them what's going on with their body. But then, it's 40 years of training.
Mm-hmm.
So now we've got the heart. And when we went to work on his heart, even though you're right-handed, his heart was 3/4 of an inch around his heart, higher on his left side than his right side. And that was all the calcium in the scar tissue, wasn't it?
Yes.
Yeah.
Yes.
And then we went in there. How painful was that for him to pull that fist apart around your heart?
Well, it was painful doing it, but it's still the after effects from the.
Well, I already told you, though, but
Yes.
you've been walking around with a broken heart all your life, like most people. And the reality is guess what? Whether you believe this or not, you need to have that done in 20 days again. So in 20 days, if we go back in here and do this, we're going to have a healing in this heart. You can't do everything right away. And it's muscle memory. Muscle memory. Okay?
Yes.
Oh, yeah.
I know how to do this. Muscle memory. A child comes and starts walking. They don't get it right away. It's muscle memory. So it's got to go from watching you do it to here, to be ingrained in the subconscious, and then to be infused as a habit through every tissue cell. Do you get it?
Yeah.
Yes.
All right. So it's not going to just change right away. And then you've got the hernia down here, so we got to do the detox so that you're no longer constipated, because you got the hernia because you were constipated. All inguinal hernias come from constipation, guys, not from you moving the couch for your wife and then cursing her for the rest of your life. So
That's what
understand,
you're told.
I know, you're rotting out. So everybody's rotting out today. So the biggest disease that we have is we are rotting in our lower abdomen, and we are filling up our pelvis with inflammation. How much scar tissue and crystallization was in your pelvis when he worked on your groin? Snap, crackle, pop.
Yeah, that's right.
It was like two fists or whatever, two humps.
Yeah. So that was the hump. You should be able to feel your pubic bone. It should be flat. When it's got a hump on it, that's crystallization, calcium, and scar tissue. We proved it because we smoothed it, took it right down, didn't we?
Yes.
So that was all the protection needed in here from the putrefaction in your large intestine rotting out your groin. So that's why women are losing babies more and more today, because the pelvic floor is rotting out. That's why we have more prostate cancer. That's why we have more bladder infections, more cysts on the ovaries, endometriosis, scar tissue on the fallopian tubes. You give me a woman who can't have a child and a man who can't have a child, they're going to have children within weeks to a couple of months. Get rid of the scar tissue, get rid of the inflammation, and teach them how to bring up their vibration, and it's going to happen. So you guys want more children, we can work on that.
Thank you.
That's okay. I love the ones I have. And my grandbabies.
Yeah,
I
of
love
course you do. So what do you think?
Well, I think it's been a positive experience. And if we need to be back in 20 days, we'll be back in 20 days.
You bet.
Yeah. Actually, you should both come back when the tenderness is gone. And understand something. If you go to your normal practitioner, because I'm quite abnormal, we know that, right? Mm-hmm. So if you go to a normal practitioner, they bruised you. No, I didn't bruise you. You can work as deep as you want on me. I'm not going to bruise. Did you get that?
I got it. I got it.
Okay. So did you ever have the person go, I don't know, I didn't bang into anything and I'm bruising? Well, that person is actually dying. I hope you know that. And then when you bang into something and you don't, I can bang into something hard and I'm not going to bruise. The more you bruise, the sicker you are. Now that can all be reversed. All of it can be reversed. Okay?
Well, that's the encouraging part about having come here is that, I got here and I was like, discouraged. I thought, this is it. This is better be work. You come with that mindset. And when you hear, this is what you have, and you were very straightforward, and I like that. It's not, I didn't come here to be babied. I thought, this is what I know that's what I have. But I also heard you say it can be reversed. It doesn't have to be. And I thought, okay, I'm hanging on to that because that's what I need. I need it to be reversed.
So you've had this problem for a year and a half?
Yep.
So we did in a day and a half what nobody could do in a year and a half.
That's right.
Okay,
and
so
30 treatments of spinal decompression, though that helped. I will never say that if it wasn't for spinal decompression, I probably would not
lose your mind.
Yeah, and I probably would not have started walking again without a lot of pain. I did lots of treatments of spinal decompression, so that did work. But it never cured anything.
Okay, so what it did was that it turned the burner down, which is really important. But understand something. Every physical problem in the body is a scar tissue issue with crystallization and calcification, and natural health does not look at that.
No.
And medical only looks at it when it becomes a tumor or a fibroid.
Mm-hmm. Yes.
Mm-hmm. Or when they can take out your hip and give you a false one. Or give you mesh. And you never want to go for mesh, like I told you. You're so lucky you did not go for mesh for this inguinal hernia. If he went for mesh and got mesh in, right now, he would have came with about 20 other complaints, because the mesh will actually create enough inflammation and infection that wherever the weak joint is in the body, it will take it down. So he would get real, really get real. The mesh, when you put it in, what happens is the inflammation will create scar tissue to just wrap around as quick as possible, wall it off so that you don't inflame the rest of the body. And because there's poisons that come off of mesh. And then you'll get calcification to create a wall to stop the parasites from coming in and to stop the inflammation from moving outward. But the reality is the mesh could have, not saying it for 100%, but it could have given you a heart attack. Because the weak link, well, don't you think that if you have a foreign object down here,
Yes.
then it creates more inflammation, more lactic and uric acid, that it's not going to bother your heart? And don't you think that inflammation cuts down on oxygen supply, so your heart's going to be going?
Yeah, for sure.
So never get mesh, get suture. If you get mesh, I warned you. Wait till you see the problems you're going to have. And the reason they do mesh is it costs $25 for the mesh. They get $2,000 for the surgery. And the only reason why doctors are told not to do it is because robotics, which is part of mesh, right?
Mm-hmm.
Which is part of implants, stents, knee joints, all these artificial things. The robotic industry is even more powerful than the pharmaceutical industry in lobbying.
Yeah.
And that's the God's truth, everyone. You think I'm trying to cause trouble? I'm not. I'm trying to tell you the playing field is like this.
Mm-hmm.
Don't ever forget who created you and that you can heal. You know, you can regrow bone. You can regrow tendons, ligaments, cartilage. And the thing is when it doesn't show up on the x-ray, it's still there. It's just hidden in the calcium.
Yep.
What do you think?
Yep.
So what are you going to do when you go home? Have you talked about it? Do you have a plan? Because if you don't have a strategy, you're toasted. Okay? Understand something. We need to be more like our government. They say if we do this to the people, they'll do this. And if they don't do that, they'll do this, and then we'll do this. They strategize every move. And when you want to get well, just like even people in the Army or the Navy or the Air Forces, they're always strategizing to win the war. And the war you want to win is on this subconscious, because your subconscious has actually created, your thoughts have actually created this physical body. So what are you going to do? And when you're thinking clear together, make a strategy to support each other, and also to wear a love band, life band, and go, no, I'm not doing this. That's the old me. I got this. I love you, Darrell. I got this. That's the old me. Change my mind. Change the topic. No, we're not going to put the chips into the cart.
Yeah.
And we're not going to be a sugar junkie anymore.
That's right.
Right?
Yep, that's right. So we know we have some nutritional things to look at, although, you always think you're...
So as soon as you go home, you may not want to do this because we come from lack, but you need to go through the cupboards and the fridge, and anything that does not meet that new life, that new vibration, must be sent to somebody who says, I'm just going to stay in a lower vibration. Give it to them as a gift because they're going to buy it anyway. I'm being serious.
Yeah.
Yes.
Yeah, that's true.
But if you love yourself, the minute you get home, okay,
Yep.
you'll get it into a box and get it into the garage. And then the next step the next day is into someone else's garage.
Yep,
Yes.
that's right. That's right.
We're not going to throw it out. But if somebody says, why are you getting rid of it? Well, because it's not good for me. Well, why are you giving it to me? Because I know you won't change. Merry Christmas.
There you go.
Christmas in June.
Yeah.
Huh?
No, for
Christmas
sure.
in June.
Yeah.
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 You know what? It's worth all the, even sitting here now, I have no pain at all. Well, my butt might be a little.
Well, I know.
But no, I have no back pain. I have no.
You're not going to. But I need to tell you, and you have to make this decision, and please, I'm saying this right online. I will always say what matters. If people don't think I'm busy, you saw how busy we are.
Yes, and I want to thank you for accommodating us because, we dropped into Kelowna on the long weekend. Could you take us? Oh, well, okay. You did. Thank you.
Yeah, well.
Thank you. That was appreciated.
So anyways, you need to think about this and then do what you think is right. But if you were to come back and learn how to work on each other, it's over. It's over. If you come back and we work on you for a few days, we're going to get you there. But how would you like to not have a pain in your muscles, your joints, or anything ever again? Or you go to roll over, like you do. You go to roll over, and then all of a sudden you feel that little kink in your back, and you go, sweetie, can you just get rid of that? And he will get rid of that in 1 to 3 minutes, and you'll wake up with it out in the morning, or you'll be hobbling because they are actually knots, okay?
Mm-hmm.
So your tissues are like this, blood supply, lymph, blood flow, energy flow. Then they get tight.
Mm-hmm.
Then they shrink, and they become knotted. When they become knotted, then it gets sticky. Your blood gets sticky, and that's how you have a heart attack, a stroke, because your blood gets sticky because you eat glicky, sticky, stinky food. That happens to your tissues, and they get a knot in them, and they get stuck together like glue, The lactic uric acid glues them. The calcium makes them look calcified, And then the water is, because inflammation is like you put a steak on the barbecue. That steak can be this big. The longer it stays, the shorter
Smaller
and the
it
thinner
gets.
it becomes, until it's like, I mean, you know what? I mean, if you tried to eat, remember yesterday the beef jerky that was on her hip? I said, you want to chew on that.
We decided not to try.
So the reality is how are we going to go in, okay, untie the knot, open up the fibers and get the blood in. So what if you knew how to do that for each other? And what if you knew how to create the perfect day and eat? And what if you got to a point that you have a different relationship, not just husband and wife, but two spirited beings? Honey, I see what you're doing. Let's change something. Let's go for a walk. Let's do this. You're not going into the flour, the sugar. You're not going to do that right now. Let's go. And instead of going, leave me alone, that would be your subconscious. You come together and you hug and we go, we got this. We are one.
Yep.
A different way of doing things. Okay? So I allow Lori to say anything to me. She's my best friend. She's my love. She's my spirit partner. And she can say anything to me. You know, I can remember, you know, we get these things that we build up throughout our life, and they're called beliefs. Okay? And I can remember when we first started going together, and I said to her, you know what? I don't know why, but I just had the awfulest feeling about you. And she goes, because we already had talked about how we want a relationship. She goes, why do you think that is? I said, I don't have a clue. And to this day, I still don't know why, but I wanted her to know that things are going on inside of me that are none of her business, and it's not her fault. But I wanted it to be her business because I wanted her to know that I'm just as screwed up as everyone else. Do you still want me? Do you understand?
Yeah.
So if you can talk together as two spirits coming together and just lay it on the table, and did you ever, and I know you did, there's times when you'd like to say something to her, but you don't want to be judged by her, and you don't want to be judged by him. But what if you never judged and you only observed and said, let's do this? That is the holy grail of love.
It's a process to get there, but
See, it's a process, because guess what?
you're programmed.
You came together with him so that he would fill your heart. He came together with you so you would fill his heart. And that's why his heart is torn apart. Okay, and that's why you're limping. Was. And guess what? We all come down and we fall down. It's not how many times you fall down. It's how quick you get up. And it's how quickly you let yourself off the hook. And how quickly you let him off the hook and say, we've come together for this life-threatening, fun-filled adventure. We got this.
And this is kind of neat because I thought I was coming myself, but now it's him and I in this journey. It's very...
You know what? It
Very
was
cool.
an evil plot, but I think you got away with it.
think.
What do you think?
Well, I was the evil plot. Is that what you're saying? I was the evil plot to
got
just
him.
get her in.
I got away with it, yes.
Yeah.
Yes.
No, you thought you were doing it, but the whole time she was doing you. Oops. I'm kidding. Okay, so
It's all good.
what do you
It's all
think?
good.
What do you think?
Like I'm ecstatic. I just am.
So when you guys start to go a little bit off track, because you will, because you're not off track.
No.
It's just that you're deciding to build a new track.
Yeah.
So
Yes.
until that new track is made, you're still on this track. So when you start to go off a little bit, who are you gonna call? Me. You're gonna call us.
I'm looking at you.
And you're going to call us,
I'm
and you're
going.
going to call us, and you're going to call us, and you're going to call us. If you had to call me 3 times today because you needed to emotionally get back on track, you're going to do it. And if you don't
Yeah.
say I didn't warn you.
Yeah.
Because the reality is this. If I wanted to go on an adventure and I've never been there before, would I want a guide? Especially if there was cliffs, right?
Hurdles.
Tigers, and that tiger being our subconscious. I'll call my guide and say, hey, am I going the right way? And I'll say, hey, no. What happens is your subconscious is really starting to understand that you are really determined to change your life, and your subconscious is crapping its drawers because your mind is 90% of your brain, and your subconscious says, I hate the present. I will never move into the future. How many people and how many times have you said this? I hate change. I hate change. Well, guess what? I love change. Okay? All right? All right?
Well, most people don't. Right?
Yeah. So don't forget, there's a jar out there that says leave change.
I have.
So the reality is embrace everything. I mean, what doesn't change here? People get born, people leave. Spirits come in, spirits go out. We age, and that's a beautiful process too. You know, if you're not, you've got to change your personality if you want to change your reality, and life's going to change. And if you don't change, then it's really tough, isn't it? Mm-hmm. Think about how much you've wrestled with things in your mind.
Yeah.
Lots.
Okay, well, don't then get a tag team partner. Tag me, right? Just tag us. Tag us. That's all you got to do. And you know, some people go, oh, God, sure, he was up to something. But you guys have already done it. And like I say, once you've had a consultation, right?
Yep.
You know what? It's lifetime with us. It's lifetime support.
Mm-hmm. Well, when I first contacted you, this friend that had referred said, oh, he'll get back to you. You phone and this doctor will get back to you. I thought, yeah, okay, sure. But this doctor got back to us. And I thought, holy, like.
He's for real.
He's for real. You're for real.
Because we are family.
You know what? I didn't think that you would get back to her.
No.
When she called. I said, well, good luck.
Mm-hmm.
Because of past experience that says, yes, oh yeah, I'll call you back. Send me an email and I'll return your email, and you never hear back. So that's where it's been. Like, how many times I have sent emails, don't get a response.
And then when we said we were coming here on the weekend, and I phoned, and I spoke with Jason. Very nice. He was like, you know, I have a Jason. My son's name is Jason. I have a special spot for this Jason here. Anyway, he said, oh, Dr. Wolfe is really busy. Hang on, he said, I'll see what he can do for you. And he came back and he says he'll see you. And I thought, whoa. I said, Ben, he's going to see us? Yes. He's going to see me, not us, but yes. So I was like, wow, okay, that's good. And although we had to, you know, I accommodated your busyness, because you are. And here we are.
Here we are. And here we go.
And here we go.
Here we go.
Yeah.
So make sure that you take the time on the way home on your drive to create strategy. So here's the things. What are the habits that you need to, you know, lovingly let go?
Mm-hmm.
What are the things you need to clear out of your cupboard, out of the bathroom, okay, out of the fridge? And where do the places you go that undermine your health? Mm-hmm. And think about how you need to change that.
Mm-hmm.
Sometimes that's difficult because it's friends,
yeah,
alcohol,
mm-hmm.
chips. I mean, you can say chips. Who cares about chips? Well, for one thing, it's rancid oil. Oh yeah, cheesies. Well, that'll light up your life.
The real cheesies.
Well,
like
that stuff all has it all has canola oil.
Yes.
It's all GMO.
Yes.
So what GMO actually does is, and a lot of that has glyphosate in it. So between the GMO, that actually makes little slices in your digestive tract, creates the leaky gut, okay? And then the glyphosate that's in almost all that stuff, all that food you just mentioned, and it's that whole bit, that actually causes an opening, it opens up the blood-brain barrier to chemicals and toxins. It's really quite evil. So the thing is that people truly can get together and have fun because they're spirited, not because they need to open up a bottle of spirits.
Mm-hmm.
Okay?
Yeah.
Yeah.
And I know that our family and friends will be supportive for sure. Like I've called my sisters because they're all like,
Yeah.
"How'd it go? And how are you feeling?" And they're all concerned. They'll be supportive. I know
Yeah.
they will be.
Well, family's always supportive, but the problem is they're supporting with the old beliefs that you had sometimes.
Yeah.
So you have to be loving and compassionate to them because they didn't come here and get terrorized by us yet.
Yeah.
Seriously. No, but it's true. You know?
Yeah.
I mean, who pays for this abuse? You and her.
That's what
Yes.
I said. Who's dumb enough to go back for the more torture? I'll do it any day. What did we say yesterday to Jason? Short-term pain for long-term gain. Have at her, buddy. Do what you need to do to get rid of these knots.
Yeah.
Mm-hmm.
Well, thank you. Thank you, Carmen.
Thank you. Thank you.
Thank you, Ben. Bob.
Bob? You're welcome.
Yeah. All right.
Thank you.
So we're going to bob on out of here. And just remember something. To create the perfect day, you need a strategy. And then all you got to do is create that strategy and then work together as a team and repeat that perfect day every day. And when you come off track, laugh, smile, hug, and start again.
Yeah.
Yes.
Never again will we judge ourselves, okay? So when you sneak the cookie, okay, or whatever it is, you know, you'll find out it's not going to taste as good, okay?
Not worth it.
No, the more you leave it, the more you're going to want to leave it. The more that you had it, the more you're going to want to have it. That's how life works.
That's right.
That's how life works. You know, people that are in abusive relationships aren't there because they love abuse. It's just they look at abuse as a type of love. Until you have better or know better, this is all I got. But now we've taken a look at something that you could do better, right?
Oh, yeah.
And the reality is you do not have to go to a nursing home. You do not have to limp, okay? And you, yes, can spend many, many more years and have this adventure. That's the truth. That's God's truth.
Well, you know what? We have been praying, God, healing. Where's the healing? There's got to be a cause to this. It's got to be a healing, right? And we talked about that yesterday. You know what? God works in mysterious ways and sent us here. Like, how did we end up here, right? We never knew about you in Kelowna, BC, like, until,
2 months ago.
2 months ago. And desperate enough to say, okay, this just better be the answer.
So you're trying to tell me that you have to be desperate to have a relationship with me?
Yeah. I was desperate. No, actually, it's been really good. Really good. Yep. I'd recommend it. Can I recommend you to other people? Yeah, I know
If you
you're
think-
busy.
if you believe that they're ready.
Yeah.
Everybody is worthy.
Yes, you have
But
to be
are
ready.
they ready?
That's true.
And sometimes when we find something that we're really excited about, if somebody's not ready, then that even becomes a form of terrorism.
Yes, it does.
Yeah.
Get
Yeah.
that for sure.
So yeah. That's why I told you if you want, take a few books and give them the book. If you see it in the bonfire this summer, it didn't work out right.
It makes good fire.
That's right.
Fire starter.
Yeah, or if it's like, they need a cool breeze through the house and it's like a door stopper. There's a clue
Yes.
there.
Yes.
Okay.
That's a message.
All right. God bless the two of you. Thank you.
Thank you.
Thank you for
very
coming
much.
on.
Thank you
Okay?
very much.
And thank you for joining us. So thanks for joining me. Don't forget, everyone, tomorrow, June 4th, 3 p.m. Pacific Standard Time, join me for my Couples Treatment and Training live Q&A, where I will answer all your questions from YouTube, Facebook, and Intercom. So write your questions below and let's grow together. When watching on YouTube, don't forget to subscribe below and make sure that you click on the bell to enable notifications so that you never miss a show. Our upcoming shows, Monday, June 8th,
Doc Talk Q&A, 3 p.m. Pacific Standard Time. Wednesday, June 10th, Mind Over Medicine, 3 p.m. Pacific Standard Time. All our shows and our Q&As are time-stamped on YouTube so that you can find your question or topic easily. Also, if you wish to listen to the audio version of any of our shows, go to iTunes, Spotify, or SoundCloud. For anyone who wishes additional information or training, please stay to the end, and you will be able to see where you can find all the links to watch what you need or read what you need. Again, thank you to all my listeners who make this show possible. God bless everyone. Take your power back, but better still, why don't we just stop giving it away? And remember, 3, 2, 1, together, we got this. If you're looking for life-saving and life-changing information, well, you've come to the right place. Don't forget to click and subscribe. Stay connected.